We begin here at 6 with those growing concerns about the new COVID variant named Omicron. Scientists are warning the pandemic will continue to thrive as long as parts of the world don't have vaccines. Cases of the variant have been confirmed in Canada, Europe, Hong Kong, Australia, and more than half a dozen South African countries. But there may be some silver lining, as doctors in the South African region say the rapid increase in cases include mostly mild symptoms. The U.S. is imposing a new travel ban that starts today to those South African countries first seeing the new variant. News 8's Shelby Kluver. Shelby, how soon do we think we'd see an impact in our region?
Well, there haven't been any confirmed cases of the Omicron variant in the United States, but health experts say it's just a matter of time. So here in the Quad Cities, the news of this mutation is renewing calls for vaccines, boosters, and masks. Finding the Omicron variant in the Quad Cities is not a matter of if, but when.
It's very likely that this variant is already in the United States.
Not much yet is known about the latest coronavirus strain, although there is the possibility it could be more transmissible than current variants. So far, early data shows our vaccines are still highly effective against Omicron, leading to renewed pushes for shots and boosters.
In Rock Island County, we're sitting at about 50% of vaccination rates. And we need to see that higher.
Janet Hill of the Rock Island County Health Department warns that increasing the community's vaccination rates also decreases the chances for future, deadlier mutations.
We know that there are going to be more variants that pop up. Anytime the virus is able to be duplicated, there's a possibility that it may mutate beyond what our current vaccines can do.
She also urges everyone to get tested if you think you come in contact with an infected person. But even before Omicron, health officials worried about a post-holiday spike in cases. On Monday, Genesis announced it had 53 patients hospitalized with COVID-19, the highest since last December.
The holidays last year were part of the biggest spike that we've seen. We expect that things aren't going to be fun between now and the middle of January.
Infectious disease expert Dr. Lewis Katz says while the world is better prepared for Omicron, masking and vaccinations remain key.
Getting immunized and paying attention to the non-pharmaceutical interventions we've been talking about for many months, it's really where we should be now.
Now, Moderna says it's mobilizing hundreds of workers to try to figure out a solution for this variant, whereas Pfizer says its vaccine could be reworked in about 3 months to help take care of this.
Okay, so you say Omicron. I was saying Omicron. There's kind of debate about which one is correct.
Right.
What do you think?
Well, the World Health Organization goes with Omicron, so that's what I'm going with right now.
Okay. All right, noted. Now let's talk about cases just in the Quad Cities right now. You mentioned Genesis has 53 hospitalized with COVID right now. That's the highest since last December. What are we seeing elsewhere in the region?
Well, as far as Unity Point is concerned, they also have a high number of patients in the hospital. Today, 47 people with 13 of those in the ICU. And according to each state's local database, both Rock Island and Scott counties have roughly 10% positivity rates over the last week.
All right, thank you, Shelby.